The implications of this work ultimately are enormous. Different societies throughout history and throughout the world have conceptualized gender and sexual orientation differently. Some version of being LGBTQ has existed throughout the world, throughout history, and will always exist throughout the world and throughout history.
The Yale LGBTQ Mental Health Initiative brings together the best scientists in the world and equips us with the time, resources, community partnerships, and space to advance the science of LGBTQ mental health locally, nationally, and around the globe.
Our work here focuses on understanding what's contributing to the mental health disparity among LGBT people, developing tools and interventions and treatments to help alleviate mental health symptoms. It also might just be understanding what LGBT folks' needs are, what resources they're already using that they might need more of, and where they're thriving already.
When I first came to Yale about 13 years ago, the field of LGBT mental health studies had increasingly compelling research, speaking to the reasons that LGBTQ people are particularly likely to have depression and anxiety, substance use, and so forth. But what the field didn't have was systematic guidance for translating that research into clinical practice. It became an obvious next step to build a program, to build a center whose role would be to take research and put it into practice.
Something that the initiative does really well is bringing together people from different perspectives as a team. Physicians, psychologists, public health people like me, sociologists, social workers. Putting all of those people in the room to think together about really challenging and complex problems is how we ultimately end up getting breakthroughs that change people's lives.
LGBT people might not see the impact of research on their day-to-day lives, but they're probably glad that it exists. We're in a time currently in the US where that research can't be taken for granted. And even though we may not see researchers and scholars and scientists doing their work on a day-to-day basis, when it disappears, we'll know.
If we don't put our resources and support into this initiative, I worry we're going to kind of go backward, and some of these inequities will grow even more than they were 20 years ago.
The academic institution is where a lot of the science is being done that helps inform policy, that informs healthcare, that informs treatment, that informs how we approach and how we understand other people more generally.
You have such a large group of people, a large part of the population that has been so underrepresented in the research. Can you really say that the research is whole or complete or good?
To me, the whole reason to do research is because it helps create pathways to create a healthier society. And this work is part of that.
The academic perspective can help us understand why are we seeing these pervasive disparities in mental health disproportionately affecting LGBTQ people and LGBTQ young people in particular. And that's really what John's work does with the lab and what he's trained his trainees like myself to also really be thinking about what are the drivers and then what can we do in order to reduce those disparities.
The Yale LGBTQ Mental Health Initiative is doing a variety of studies and a variety of types of studies. One big centerpiece is the work to develop, test, and implement LGBTQ affirmative cognitive behavioral therapy.
We interviewed probably almost 100 LGBT people, learning about their lives, learning about what they would like to see in their treatment. We interviewed dozens of mental health providers who had spent their entire careers working with LGBT people. And we packaged all of that community wisdom and that clinical wisdom together with the tried and true principles and techniques of cognitive behavioral therapy and put that together into a treatment that we then tested in several randomized controlled trials. These were the first RCTs ever conducted on a mental health approach specifically for LGBT people, which is perhaps a little surprising since that was only maybe 13 years ago.
If we rewind the clock 50 plus years, the predominant explanation for the health disparities and mental health specific disparities we see between LGBTQ people and their cisgender and heterosexual counterparts was explained through ideology and pseudoscience.
Sometimes there still is this pervasive view that there's something wrong with LGBTQ people. But in fact, what the research can show us is that these are socially driven mental health disparities.
While we're continuing as a society to work on this issue, what can we do to best equip this population with the science-backed, evidence-based skills, coping strategies, ways to be resilient as we're still working on this larger societal issue?
The mental health treatment that we tested and developed at Yale, the first evidence-based mental health treatment created by and for LGBTQ people, has been implemented in community settings across the US and across the globe.
My focus specifically is on translating the evidence and the tools, discoveries that we are finding into community settings to make sure that LGBT people, to make sure their providers, their therapists, their doctors are receiving the science that is being developed here and across other academic institutions.
Me as a therapist, I can help X number of people, but there's a limit to that. When I work with people who, in training other therapists or other providers in this approach, that impact or that potential impact grows so exponentially.
We all, as therapists, probably have clients who are a part of the LGBTQ community. We just may not know it. This training really emboldened me to make sure that I was saying things to my clients that would let them know, that would communicate to them that I was a safe person. So part of that was simply telling my clients that I was doing this training. I can say that I can do this work confidently because I have the backing of this solid training from Yale behind me. And that felt really valuable and meaningful.
One of the reasons LGBT people tend to seek out mental health care at LGBT centers specifically is because it's a sure thing that that's going to be a safe space for them. They have long wait lists for clients to receive therapy because that's the place where the queer affirming therapists are.
Our work shows that providers in those centers are delivering this treatment to tens of thousands of LGBTQ people. Also rewarding is the fact that other settings like college counseling centers, like the Veterans Health Administration and other settings globally are also implementing this treatment.
Doing a community partnership with Nashville Cares. I've done some research with Black LGBTQ people, studying their unique challenges and stressors.
We want to make sure that everyone is okay within themselves. So doing a research project through Yale, through Tenacity is really important, specifically because mental health is everything. You have to have the courage to sometimes walk through our doors. That's why research is so important.
Everything we've learned through science is something we figured out. Like, we had to figure out how to get here. So to be part of a study is to be part of helping figure out how to get somewhere else. I only hoped that the study itself would benefit from my presence as much as I might benefit from its existence.
We see that people continue to have enduring benefits from the therapies that are offered. They also, in some cases, build new relationships. I, for one, do quite a bit of research on group psychotherapies, which brings people together in new ways.
There were the few of them who weren't really invested in the community. And during the last session, they were like, well, you know what, maybe I will finally go to a Pride event.
It was extremely impactful to be amongst people who reminded me that we're all learning all the time about who we are and where we fit. It was about community. It was about what can we learn from one another.
Just approaching the topic is really hard for people because everyone has a different idea of when you say mental health, they're thinking something's really wrong with me. It doesn't have to mean that.
I have trauma, and that's okay, right? We live in a very traumatizing world, and there are exercises and people that are able to help me with that.
Still today, our research shows that the majority of LGBT people around the world are completely closeted, meaning they've told no one or very few people about this important part of their lives. The possibility for that reality to decrease in our lifetime disappears without a group of people who's working to reduce the isolation and loneliness and fear that's ultimately driving statistics like that.
Being able to work on interventions for the same issues that have impacted me and still impact me today has not only been very pivotal for me, but I would say extremely gratifying.
We provide a home for scholars at Yale, for students, faculty, and colleagues who are interested in this mission.
One of the cool things about the initiative is it brings people to Yale. Almost all the applicants that I see, whether those are faculty, whether those postdocs, whether that's students, when I ask them why coming to Yale, it is because of this initiative, and they would go to wherever this initiative is.
The fact that Yale has created space in its mission for this work helps us move forward despite the headwinds.
The research conducted by our lab and by the many scientific collaborations we have with folks at other institutions, that work has been a part of the evidence that's been needed to advance the rights of LGBTQ people throughout time.
Bringing together a research team like that in the Yale LGBTQ Mental Health Initiative is time and money intensive. This did not happen overnight. It required Dr. Pachenkis to find other faculty who he could work with, to train up generations of doctoral students, postdocs, research assistants, undergraduates. This has been a labor of love for him and his colleagues for over a decade. Losing that would be tragic. It would be a loss of expertise, it would be a loss of knowledge, and most of all, it would be a loss of hope.
If we can learn what it means to help people cope with the mental health impacts of marginalization and also how to address marginalization at its source, there's no reason that that has to stay focused on LGBTQ people. That can be expanded to many people, many different experiences of marginalization, which of course often operate in concert with one another. And so when we're thinking about LGBTQ mental health, we're already thinking about the mental health impacts of racism, we're thinking about the mental health impacts of sexism or ableism and so on and so forth.
We look at a lot of negative and difficult things. We're focused on stress and strife a lot. However, I think the full understanding of LGBTQ mental health has to increasingly and continuously involve joy, happiness, strengths.
Who knows what things will look like in the future? None of us have a crystal ball. We can only hope that LGBTQ people are accepted in society and given the family support, the community support, the social support that they need to thrive and, exist as the beautiful and creative community that they are.
One of the driving forces of our work is to see if we can reduce this mental health disparity in our lifetime through the way we're applying science to practice.
The scientific study of LGBTQ people, of LGBTQ mental health, of LGBTQ mental health disparities versus the general public is in its infancy. But as we see this nonlinear movement towards inclusion, affirmation, and justice for LGBTQ people, what we can also see, if we look closely enough, is that science has been really critical to the steps that we've taken forward.